Hi, everyone. I'm Bob Margolis, and coming back to Duke is always a treat for me. As Mark said, I was here from 67 to 72, and it really became the formation of the way I thought about healthcare and medicine. Duke, you should all be amazingly proud of what Duke offers. Seeing this, and as Mark said, I'm a bit of an entrepreneurial physician that believes in trying and finding new ways to deliver high quality, accessible, and patient-centered care for more Americans, or actually for the world. And so having a formation of an idea about health policy and the importance that it could play and should play in creating and innovating beyond the system that we all have today. And in my view, Americans don't get the health care they deserve unless they happen to be here at places like Duke. And so having a formation of an idea, and let me give you a quick tour of my journey to get here, and then seeing that within 6 months, you have put together an enormous opportunity to really propel health policy on a national and global stage, as well as create a center that puts Duke on the map relative to its position as a leader, as the go-to place for health policy makers and politicians that put their finger in health. Usually mess it up, but if we can figure out how to give them advice that actually leads to creative, innovative solutions. So a quick journey. I was here, did my medicine and my internal medicine residency here at Duke, went on to National Cancer Institute, where I spent several years in oncology and oncology boards and so on, did one postgraduate year at UCLA, found some like-minded physicians and went to work in an inner-city hospital in central LA that was really having trouble finding physicians. So we formed a small group that over time became a large group, and its goal was to figure out innovative, creative ways to deal with healthcare in a way that made it accessible for folks that traditionally didn't have much access to healthcare. And that grew, and there was a lot of serendipity, because the beginning of managed care, as it was called back then, was really a West Coast phenomenon, and we jumped on it probably without having any idea what we were doing. But ultimately, before I retired, we had over 1 million patients under global population health capitation payment. And as you'll learn if you hear more about this from Leslie Curtis, who's working on population health, and the commitment of Gene Washington and others to turn Duke into a true population health-centered center of excellence. It flips healthcare right on its head. It makes it so that those of us that are accountable and are getting paid to be accountable for the health really have to focus on prevention. We really have to focus on avoidable illness, and we really have to focus on keeping people at the lowest appropriate level of care with the kind of care teams and support that allows them to really flourish and stay healthy as long as they can. And so that is really, as I grew in my healthcare career and got involved in a lot of advocacy, it was really around population health and the kind of health delivery system reform that leads to coordinated, integrated care systems. And because I was in Washington a fair amount, giving talks and being an advocate for multiple associations that I was involved with, something occurred to me early on. This is probably over the last 5 or 10 years, and that is there were the same university experts always testifying alongside, and they weren't from Duke. Now the Duke folks that were testifying were about clinical excellence and incredible research and opportunities to improve care on a clinical side, but on a policy side, they really weren't from Duke. And so the opportunity arose to say to, at the time, Victor Shao and Nancy Andrews, why don't we do this at Duke? And that really evolved into ultimately engagement with Dick Broadhead, who I have to say was an incredible assistant and leader in thinking this through, and ultimately into the formation of the Duke Health Policy Center. Attracting Mark, who you all are getting to know, has been an absolute dream, because there's nobody better positioned to lead a health policy center, in my view, than Mark. And seeing this grow in less than 6 months, or just about 6 months now, with the help of the leadership from Mark and Greg and Vicki and all of you, is very, very heartwarming. So I want to just thank you all for your participation, your interest in health policy. Let's put Duke on the map as the place to go when policymakers, both in the US and around the world, want to evolve our system into better access, better affordability, patient-centeredness, and great care for all. So thank you very much.